If you're over 60 and your teeth have been getting yellower no matter how much you brush, this video is going to explain exactly why. And the answer has nothing to do with coffee, tea, or red wine. A 2024 study from Johns Hopkins tracked 5,800 adults over 60 for 3 years and discovered that 79% of tooth yellowing in this age group comes from 4 specific biological changes that begin after 55. Changes that most dentists never explain to their patients. Stay with me, because once you understand what's actually happening inside your teeth, the solution becomes surprisingly simple. Before we dive in, drop a comment right now telling me, do your teeth look noticeably different than they did 10 years ago? Your answer might tell us exactly which of these 4 causes is affecting you most. Here's what nobody tells you about aging and teeth. Your teeth are not solid. They have 2 main layers. The outer layer is enamel, the hard, white, semi-transparent shell. Beneath it is a layer called dentin, and dentin is naturally yellow-brown in color. When you're young, your enamel is thick enough to mask the dentin underneath. But here's what happens after 60. A landmark study from the University of Michigan found that enamel thins at a rate that accelerates dramatically after age 55, losing up to 30% of its original thickness by the time most people reach their late 60s. As enamel thins, that yellow dentin underneath shows through more and more, no matter how white your toothpaste claims to be. This is why most whitening products barely work for people over 60. They're treating the surface, but the yellowing is coming from inside the tooth. The Johns Hopkins research identified 4 specific reasons this enamel thinning accelerates after 60, and most people are dealing with at least 2 of them without knowing it. Cause number 1, dry mouth from medications. A study from the Mayo Clinic found that adults over 60 take an average of 4.5 prescription medications daily. Over 400 common medications, including blood pressure drugs, antihistamines, antidepressants, and diuretics, list dry mouth as a side effect. Here's why this destroys your teeth. Saliva is your mouth's natural defense system. It neutralizes acid, remineralizes enamel, and washes away bacteria. When saliva drops, bacterial acid stays in contact with your enamel for hours longer than it should. Research from the American Dental Association found that chronic dry mouth accelerates enamel erosion by 340% and dramatically deepens tooth yellowing within 18 months. Cause number 2, the overnight acid pool. After 60, your body produces significantly less saliva during sleep, a drop of up to 95% compared to daytime levels, according to research from UCLA. This means the bacterial acids that accumulate overnight sit directly on your teeth for 7 to 8 hours with almost nothing to neutralize them. Over years, this creates a cycle of microerosion that slowly strips enamel and exposes more dentin. The yellowing that results is gradual, which is why most people don't notice it happening until the change is already significant. Cause number 3, microcracking from a lifetime of grinding. A study published in the Journal of Dental Research found that 73% of adults over 60 show evidence of bruxism, teeth grinding, much of it happening unconsciously during sleep. Over decades, grinding creates thousands of microscopic cracks in enamel. These cracks do 2 things. They allow staining compounds from food and drink to penetrate deep into the tooth structure, and they accelerate the thinning process. A 10-year study from the University of Oslo found that adults with undetected grinding had enamel loss rates 4.1 times higher than those without. Cause number 4, gum recession exposing root surfaces. This one shocks most people. Your tooth root has no enamel at all. It's covered by a substance called cementum, which is significantly more yellow and porous than enamel. As gums recede, which happens to over 88% of adults over 65 according to the CDC, more of that yellow root surface becomes visible. Whitening treatments cannot whiten cementum the way they whiten enamel, so if gum recession is a factor, standard whitening approaches will always produce disappointing results. Section 3. What actually works. Now here's the part that matters. Based on research from 5 major dental schools, there is a specific protocol for adults over 60 that addresses the actual biological causes, not just the surface staining. Step 1. The remineralization rinse. A 2024 study from Northwestern University found that rinsing with a solution of nanohydroxyapatite, the same mineral that makes up enamel, for 60 seconds each morning rebuilt measurable enamel thickness in adults over 60 within 90 days. Participants saw a 41% reduction in visible yellowing and a 67% reduction in sensitivity. Look for a mouthwash containing nanohydroxyapatite. It's now widely available and costs less than most whitening strips. Step 2. Address dry mouth before bed. This is the most overlooked intervention. A study from Boston University found that adults over 60 who applied a saliva substitute gel to their teeth before sleeping had 58% less overnight enamel erosion than those who didn't. The gel mimics saliva's natural defenses and remineralizing properties through the night, exactly when your natural defenses are at their lowest. Step 3. Drink water strategically. Research from the Mayo Clinic found that drinking a full glass of water immediately upon waking stimulated saliva production by 52% within 10 minutes. For adults over 60 dealing with medication-induced dry mouth, sipping water consistently throughout the day, not just when thirsty, maintains saliva flow well enough to reduce bacterial acid contact time by 44%. Cause number 4. The cheese protocol. This sounds unusual, but the research is strong. A study from the Academy of General Dentistry found that eating a small piece of hard cheese, about the size of a sugar cube, after meals raised mouth pH by 2.1 points and increased saliva calcium concentration by 34%. Calcium from cheese is bioavailable in a form that directly supports enamel remineralization. For adults over 60, doing this consistently after lunch and dinner produced measurable improvements in enamel mineral density within 60 days. Step 5. Talk to your dentist about your medications. If you're on any of the 400-plus medications linked to dry mouth, your dentist may be able to work with your physician to adjust dosing timing or recommend a prescription-strength fluoride treatment that compensates for the reduced saliva protection. A study found that prescription fluoride varnish applications every 3 months reduced enamel erosion rates in medication-dependent dry mouth patients by 62%. Section 4. The 90-day outcome. When adults over 60 implement this protocol consistently, the results are documented and significant. A study from Tufts University tracked participants who followed these 5 steps for 90 days. At 30 days, tooth sensitivity had decreased by 51%. At 60 days, gum inflammation had dropped by 63%, and participants reported visibly brighter teeth. At 90 days, dental measurements confirmed enamel mineral density had increased by 28%, and yellowing had reduced by a measurable 44%. More importantly, the progression stopped. The gradual yellowing and thinning that had been accumulating for years plateaued, and in many cases reversed. That's the goal, not a one-time whitening treatment that fades in 3 weeks. But the research is clear. It is absolutely possible to slow, stop, and partially reverse this process at any age, including well past 60. Starting tonight, try this. Drink a full glass of water before bed, and if you have it available, apply a small amount of nanohydroxyapatite toothpaste to your teeth before sleeping, without rinsing. That single change begins the remineralization process overnight. Tell us in the comments, which of these 4 causes do you think is affecting your teeth most? Dry mouth, overnight acids, grinding, or gum recession? And if you found this valuable, share it with someone over 60 who's been wondering why their smile has been changing. They deserve to know the real reason and the real solution.